Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help.
Hey everybody, welcome back to the Wild Health Podcast. Here with one of our coronavirus updates. Mike Mallin here. I'm here with Dr. Mike Stone. Hey, Mike.
Hey, how's it going, Mike?
Doing pretty well.
So I had a question for you. I remember you telling me a story at one point about developing ESPN and being able to, that's what I call it, by the way, not ESP, and being able to predict your influenza a season or two ago before it happened.
Yeah, so this is a really interesting story. In, what was it, like October of, I guess, maybe 2018, I got an Oura Ring. I've had one since then. And in February, I came down with a case of flu A. And what was really interesting was right before it happened, I noticed this really exceptional drop in my heart rate variability, and I noticed a bump in my temperature. And this was actually before I had symptoms, before I was really symptomatic. I mean, maybe I was a little more run down, but it wasn't, full blown influenza at that point. So this was just a really interesting.
Wait, tell me what kind of drop, what kind of bump?
So I'm actually pulling it up right now on my phone. It looks like, so my resting heart rate bumped 6 points.
Okay.
The night before I got infected with the illness, my temperature bumped 2 degrees, which is
2 full degrees.
2 full degrees, which is a pretty remarkable change with an Oura Ring, obviously, right? Typically we're talking about like changes of like 0.2 degrees Fahrenheit, and this was a 2 degree change Fahrenheit. And my heart rate variability, let me scroll back to it real quick.
Yeah, well, while you're looking for that, the not uncommon to see these like 0.1 to 0.3 variations in temperature day to day on your Oura Ring. So definitely no need to panic when that happens. But that 2 degree shift was a 2 degree increase in Fahrenheit in your temperature with no symptoms.
That's right, without symptoms. And then the heart rate variability drop was about 8 points in heart rate variability, which is substantial. Granted,
sure,
you can get that drop from having a few drinks or working out too hard or not getting enough sleep. The other things will do that as well. But this was a night where I had an appropriate amount of sleep. Was not out drinking or doing other things that would suggest a drop in my heart rate variability.
Wow. Okay. So maybe a little bit run down, but nothing specific. And then you notice this stuff coming up through your Oura Ring in the morning. You take a look and you go, my temperature is 2 degrees higher and my heart rate bumped last night. Did you do anything specific at that point, or just kind of monitored and see how you felt?
No, I didn't pay attention to it.
Just disregarded it as measurement error.
Disregarded it completely and kept going, as most of us do, right? But now that I have that experience, it's a lot easier for me to look at the data now and say like, whoa, I need to I need to pay attention. What's going on here? Do I need to dial it back and try to fight this thing off? Or, and I'm not, it's not true ESP, right? I mean, you don't know exactly what's going to turn into something and what's not, but I do have a little bit more, appreciation for the data now, I think, because of that.
So what happened in the natural history? I know you've told me before, but for the listeners, so you blew it off as measurement error, and then what happened next?
Well, I was stuck teaching a conference, actually. So I taught a conference that day, and then around midday that day, I just got totally hit by it. I mean, it was like, as people describe it, you get hit by a truck or hit by a train, as a lot of people describe it, and I could definitely tell what was happening at that point. So,
yeah.
And then I was also stuck giving lectures for the remainder of the day, unfortunately. But what are you going to do?
Gotcha. Okay. So, in an alternate universe, maybe you wake up, you see a 1 degree or a 2 degree shift in your temperature, and maybe you back off and, start doing any sort of immune boosting therapy that you think might help early on, whether it's, mega dosing on zinc or vitamin C or whatever else you think might help you. Hopefully at this time, with people listening to Wild Health Podcast, you're aware of a bunch of things you could be doing in the meantime, sleep being obviously a huge thing, and then some of the other immune therapies that we've talked about. But so let's move away from using it to diagnose, or to maybe get sort of a heads up on what's coming. But let's say that I come down with SARS-CoV-2 and develop symptoms of COVID-19, and I've got cough and myalgias and maybe a little tiny bit of shortness of breath, but nothing that's limiting my daily activities. Is there a way that you could foresee me monitoring myself at home in a way that doesn't endanger myself or seem irresponsible, while still avoiding contact with the healthcare system and not clogging up the healthcare system and spreading contagion and utilizing resources? And if so, how would you do that? How would you monitor yourself?
This feels like a leading question.
Well, I mean, the answer could be no. I think you're completely off base, and take your Oura ring and go to the hospital.
No, of course I don't. Of course I don't think that. I mean, I've already, and we've talked about this before, but I've already taken some steps to be able to do that myself. So I've got a pulse oximeter at home, which anyone can buy online or at Walmart or anywhere like that for, like $20, which will allow you to monitor your pulse ox, which is probably the most important vital sign when it comes to COVID-19, right? Like that's the thing that's really going to determine you need to be admitted to the hospital first, I think, is a low oxygen saturation requiring oxygen therapy. Other things that I've thought about are obviously still using my Oura ring and my Whoop to keep track of my heart rate variability, my temperature at night. And it's just a good way to monitor your overall health. A blood pressure cuff, super cheap and easy, allows you to monitor your blood pressure, make sure it's not dropping. What was the other thing we were talking? Oh, ultrasound.
Well, sure, there's ultrasound. But I mean, before we get into ultrasound, because we've talked about that on another podcast and we don't need to dive super deep, the devices that you just talked about, so being able to monitor at home with pulse oximetry, which also gives you your pulse, although obviously you could just measure that by feeling your pulse. And just for listeners, what's a number that would worry you for pulse ox? 90, 94 or lower, or you're thinking needs to be lower than that before you start being concerned about your oxygen saturation?
I don't know. I mean, start being concerned. I think about 90 or less is when I start thinking about hospital admission. So sitting at home watching my pulse ox, yeah, I think I know that I sit at about 98, 99 on a regular basis. So if I was starting to, kick 94, I think I'd start to get a little bit more concerned, and maybe monitor things a little bit closer. But
sure.
Once you get to 90 or lower is when things are like, oh, okay, I need to be in the hospital.
Yeah, I think 90 is definitely assuming that you don't have underlying lung disease, you're not already on oxygen at home or something that you know about where you're normally drifting low. I think most of us would agree 90 is definitely a red flag that it's time to go get some oxygen therapy. But the pulse oximeter, blood pressure cuff, Oura Ring or Whoop Band, I mean, you're picking up all of those for basically under $500, right? I mean, the Oura Ring or the Whoop is going to be the most expensive component there, and that's going to run you somewhere in the high $200 range, whereas a pulse oximeter and a blood pressure cuff you can get for well under $100.
Oh, easily. I mean, blood pressure cuff and pulse oximeter, honestly, less than 50, and pretty useful, I think, especially in our current situation.
Yeah, and if you're able to interface with a healthcare provider via telemedicine or phone call at the same time that you're able to get this information from home. I mean, if we're going to talk about flattening the curve and reducing the strain on the healthcare system and allowing our frontline providers to care for the sickest people, but not be utilizing resources and personal protective equipment and everything else that's limited to care for people who don't really need that level of engagement. This is something that if you want to do something and you want to contribute to easing the burden on the society of this pandemic, this seems like something that anybody with the resources to get a pulse oximeter and a blood pressure cuff alone, even if you couldn't get a Whoop Band or an Oura Ring, that's something you can monitor at home and just see how you're doing and avoid these additional healthcare encounters, not only the ones that, where you go and you're suspected to have COVID-19, but you look well and your oxygen is fine and you're sent home. But the ones where it doesn't sound like you had COVID-19 and you just exposed yourself to a bunch of people who probably are milling about at that healthcare facility with COVID-19.
Right. And in the effort of social isolation, it's not like we're doing anything differently. I mean, I guess there's a difference between self-quarantine and social isolation. But, for the most part, I think in this day and age, if you get ill, it makes sense to basically quarantine yourself. Because a lot of times you can't get a test right now. So unless you happen to live in a location where they're doing outpatient testing, which is not currently most places that I've talked to, it makes sense to just self-quarantine yourself when you get ill. So it also makes sense to be prepared to do that. And I think having these devices is part of that equation.
Yeah, I think it lets you stay home with a little bit more confidence that, if your oxygen sat's running 96, 97%, your blood pressure is, running where it normally runs for you. And certainly I'd encourage you, if you're going to get these devices, to get some baseline measurements while you're asymptomatic and kind of see what your normal blood pressure is and where your sat runs. And then you can just follow along and have that confidence that, if I went to the doctor, they'd look and tell me my vital signs were normal and they'd send me home. And you are, I think it's safe to say that in today's day and age, you are not getting admitted to the hospital if you don't have an oxygen requirement. It's really hard. I mean, not for all diseases across the board. Obviously, you could have like appendicitis or a really badly fractured hip or something that you need to be admitted to the hospital. But if we're just limiting it to COVID-19, and that's, obviously what we're talking about today, if you're not hypoxic, if your oxygen levels aren't low, I can't foresee you having any significant chance of needing hospitalization. You'd recover at home.
No, I mean, unless you had another significant vital sign abnormality, or maybe if there was just a phenomenal amount of risk regarding, chronic disease or something like that. But otherwise, I think you're right, Mike. I think oxygen is the number one player here.
Yeah. And then, if you're a healthcare provider or you are already social distancing with a healthcare provider in your home, some of the handheld ultrasound systems are just another level of information about what your lungs are doing and whether your disease is kind of clearing or progressing in terms of pulmonary involvement. And you can see our other podcast on lung ultrasound for diagnosis or evaluation and monitoring of pneumonia or lung involvement from COVID-19. But, if we're going to do something that's going to be accessible to everybody, I think, prior to this pandemic, I was not recommending that people have pulse oximeters and blood pressure cuffs at home. I would think it was just a recipe for over-checking and over-worrying and getting, one abnormal blood pressure measurement and kind of, being really concerned and utilizing healthcare maybe more than you need to. But in this case, I think given how affordable these devices are, I think this is something that I'm definitely recommending my patients pick up and my family is going to be ready with as well.
Absolutely. I think that's a good idea, Mike. And I think some really, really sound advice for our patients. All right. Well, thanks for joining us again for this COVID update, and check back soon. We'll have more, I'm sure.
Sounds good.
Thanks so much for listening. You can continue to tune in for updates throughout the day and every day, and feel free to share this with anyone who you think would benefit. You can follow us on Instagram or on Twitter at WildHealthMD for written updates and summaries if you can't listen in. And you can refer to wildhealth.com, where we'll be collating our updates all in one place.